Yeah, you don't because it's a telephone call and there is a picture, so you don't need to open your camera. Okay. Yes. Shall I start the 3 minutes?
Oh, yes, 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 yes.
Okay. There is still some entries down if you would like.
Yeah, okay. If you can go down, please. Okay, if we can go down.
And that's the last. No, no more.
Okay. Mm. Can we go to the top?
Up? Yeah, sure.
Mm.
Just make sure we open the recording. Yes.
Hello, hi, this is Dr. Mir, GP from the surgery. Am I speaking to Emma Taylor?
Oh yeah, Doctor, I'm Emma.
Oh, hi, Emma. Emma, I've had a look at the picture you've sent to us today. Is that what you wanted to speak about?
Oh yeah, Doctor. My tonsils keep keep becoming inflamed every now and then, and I really this is my third. I had three antibiotics in the last few months, and now it's playing up again, and I think I need another antibiotic. But really, I want to also cure, Doctor. I cannot continue like this. I have work to go for, and every now and then when I find it, becoming white like that, it's bothering me.
Okay. Oh, yeah. I'm so sorry to hear that. This does sound really hard. And I've had a look at your entries. You're right. You've had to come to us a couple of times for the same issue. So if you've mentioned work, I've written that down for you. So you've mentioned work, and also said you want a cure for this. What did you mean? Can you elaborate on that?
I think maybe we can remove it better, Doctor, to get rid of it. I mean, for
Okay.
how long it will be like that? Every now, white spot on it, and I think it's also making my breath very bad, and I'm embarrassed a little bit, and I'm working in customer service, and that's really making me, ashamed, and also my boyfriend did mention something regarding my breath.
Oh, I'm sorry to hear that. And about your breath, has this always been an issue? Or is it every time, you get an infection?
Well, whenever have this white spot, I'm always having bad smell.
Okay. And about this, when did this start this time around?
Yes, 2 days ago, even not yesterday, 2 days ago.
Okay. And have you any temperature with this?
No, no temperature.
Okay. And what about I mean, were you unwell in any way before this started? Any cough?
Well, my hay fever is playing up. It's always like
Okay.
that. It will be preceded by the hay fever, closing my nose and then I will find these spots there.
Right. And what about your eating and drinking? How's that been?
No, I'm eating fine. I'm eating.
Okay. No pain.
Probably
Okay.
I can do with more water probably.
Mm-hmm. Okay. And in terms of, you mentioned the bad breath, so I understand, but just a few more questions just to check. Do you ever get any acidic taste in your mouth?
Yeah, especially in the morning, doctor. Yeah, I feel that there's metallic taste in my mouth.
Hmm. And does that, have you tried any medication for that?
No, not really.
Okay. And any tummy pain with it?
No, not tummy pain, but sometimes I will have heartburn, doctor. Hello?
And any besides your hay fever, and I see on fexofenadine, any other medication you've tried or have taken out over the counter?
Oh yeah, I'm getting, this, nasal wash, saline wash, and there is some nasal spray. I'm taking steroid and, so for my hay fever, yeah. But nothing for
Okay.
my throat other than, the antibiotics.
Okay. And you mentioned you've had around, and I've had a look at the notes, like you've needed around 3 antibiotics so far. Um, have you needed any more this year?
No, it's three.
Okay. Okay. And what about last year?
Well, I think the same, doctors, 3 to 5, 4 maybe. So every year I will get like 4 courses of antibiotic or 5 courses of antibiotic.
Okay. And would you say that's been similar for the last 3 years?
Oh yeah, more or less, yeah.
Okay. And just to quickly check, in terms of, what do you, I mean, I understand you said it's a throat infection again. What do you think? Why you just getting it because of the hay fever? Is there anything else?
I'm not sure, doctor, to be honest. There is some thoughts in my. I'm not sure if appropriate to think like that, but I'm a little bit. I don't know from where to start.
Please go ahead. Do tell me.
So, doctor, me and my boyfriend used to have oral sex. So I'm
Mhm.
just worried is that maybe is that can be STI or something. I mean, because it's uncommon that tonsils will keep having these white spots every now and then.
Okay. And when you mention STI, is it okay to ask you a few personal questions, please?
Okay, sure.
Yeah. So I understand you mentioned your boyfriend. Is this your long-term boyfriend?
Well, no, that one, we are now 6 months together.
Okay.
But previously, I had a couple of boyfriends, and it was always the
Hmm.
same issue.
Okay. And is it multiple partners or a single partner at the
No, no, no.
moment?
I never with two males at the same time. No, doctor.
Okay. And because you mentioned the STI, is there any discharge from down below?
Oh no,
Okay. And any previous history of STI?
no, no, not really. Maybe when I was teenager, probably.
Hmm. And when you engage in sexual intercourse, do you use protection?
Not for oral, doctor. Do I need it?
Okay. Okay, we'll discuss about that. And about what are you worried about? Is that the STI you mentioned?
Both, to be honest, the STI, and also I need, if it's possible, to get rid of the tonsils to, to avoid this bad smell mouth and all of this, white spots every now and then.
Any white spots anywhere else, especially around your vagina?
No, no.
Okay. And right. And is there anything specifically you were hoping from this consultation?
Oh yeah, just maybe antibiotic for the time being until, probably would refer me to maybe the throat doctor just to remove the tonsils.
Yes, of course. We will discuss that. And just to check on the lifestyle because they can affect and things like alcohol and smoking can predispose one to having STIs and also throat lesions. Do you smoke?
Oh yeah, I smoke, doctor.
How
I
much do you
vape.
smoke?
I vape,
How much?
doctor.
Okay, you vape. And is that quite often then?
Oh yeah. Uh, I'm always wind up with the vaping, as otherwise, we're on customer service. Dealing with with customers is not easy.
Mm-hmm. And with this, do you ever got any hoarseness of voice?
No.
Okay. And what about alcohol?
Uh, what you mean? Yeah, I drink.
How much do you drink? Is it, would you say it's less than 14 units a week?
Well, I usually I like to drink over the weekend, probably. Look, I will share a glass of bottle with my boyfriend.
A glass of bottle
Sorry, a
of
bottle of
wine.
wine. Sorry, a bottle of
Okay.
wine. Yeah, sorry.
Okay. Any other street drugs?
Oh no, no. I think I'm beyond now. Beyond that now, doctor.
And you mentioned work, you work in customer service. Is everything okay at work?
Yeah, well, it's always stressful, but I'm coping.
Okay. And at home, who else is at home?
Me and my boyfriend, sometimes because he didn't move in or yet, so he's coming. Maybe over the weekend he will sleep over.
Okay. Right. Thank you so much, Emma, for sharing all that information. I understand it can be quite hard to share everything, but this is very helpful. With There are a couple of things you've asked me and which I would like to discuss. So the first would be regarding your throat infection at the moment, and you are right, you do meet the criteria, and I can do another prescription of antibiotics for you. And from what I see, you've previously had phenoxymethylpenicillin and you've been fine, you haven't reacted. So I can do the same prescription. Would that be okay?
Oh yeah, sure, doctor.
Right. And also with the tonsils, because it seems you've been having recurrent tonsillitis, which means just recurrent and repeated throat infections. Now, with that, I think with what you tell me and the number of episodes, you do qualify, and I can make a referral for you to the specialist throat doctor to see
Mm.
what they would want to do next. And sometimes they can do a surgery, but I'll leave it to them for them to decide. What is that something you're looking
Yeah,
for? Is that
sure, sure, doctor. And will when they remove it, would they, this white spot will stop coming back?
yeah, so because it's on the tonsil, it should stop
Mm.
coming back.
No, but yeah,
Yeah, and
sometimes this white spot, will come out, doctor, and they are very
really.
smelly. Yeah,
Okay.
it will be like, I'm not sure. It will be hard thing
Mhm.
coming out from my mouth.
A hard thing
Some,
coming out from your mouth.
yeah.
Okay. Right. I would suggest now the other thing is with what you tell me, I'm thinking if if there's an also infection going on here and also with what you've shared with me regarding your history.
Mhm.
Um, if I'm honest, how about you making an appointment with the STI clinic?
Oh, yeah, sure. So you think I need to have what they will do?
Yeah.
So you think it might
Yes.
be STI?
Yeah, it can be, and it can grow in, yeah, it can be. And with the history you've told me, they will do some swaps for you. And the good thing is they can also do contact tracing. So it's actually very helpful. Hmm. And they can do some other tests like HIV as well.
HIV. Oh my God. So so my boyfriend is cheating on me, doctor.
No, no, I'm not saying that, but with unprotected sexual intercourse, that's always a possibility, especially with multiple partners. I'm absolutely not saying HIV, but it's just something they would be
But I
checking.
didn't
And
have
other,
multiple partners, doctor. It's only one man with every relation.
I understand. I'm sorry if that did not sound right, but it's just for your, just for safety, they can do tests, they can do some
Sure,
hepatitis,
yeah, I don't
and they
mind
can
that.
do HIV.
That's fine.
Would you want to go to them to get it, or do you want to get it done in this GP surgery?
No, no, I will go to them probably.
Okay. Also, just to know that if you feel that this increases in size, you have any difficulty swallowing, or the swelling appears more one-sided, just to get in touch with us.
Hmm. Sure.
Um, yeah. For the, can I go on?
Yeah, yeah, go on. Because still there is some points. Go on.
For the, because you mentioned the bad breath.
Hmm.
I think because you also mentioned I get reflux sometimes. Do you want to try some omeprazole? Just to,
What
because a
is
lot
that?
of time, so a lot of time we can get reflux, which is, um, which is like the taste, which you mentioned, acid coming, taste of metallic taste in your mouth.
Hmm.
Just could be the acid from your stomach coming up.
Hmm.
And we can give you a medication to kind of decrease that acid production
Hmm.
to ease the symptoms. What do you think?
Oh, yeah, sure, doctor.
And so I can do the prescription of omeprazole for you. And if your symptoms still continue, we can also try some over-the-counter Gaviscon, which is
Hmm.
again something at night, so you don't have these symptoms in the morning.
Sure, sure. Okay.
Just, I should have checked earlier. Do you have any body aches, any joint pains,
No,
any rash?
no.
Okay, right. I don't know.
Why, doctor? What are you thinking of?
Yeah, just because of HIV, just
Oh,
other
no,
sexually
no.
transmitted infections.
No, I don't have any rash.
Yeah,
Yeah,
I'm not sure what did I get.
you
Yeah, that's
finished?
it. Yes, I'm
Yeah,
finished.
okay. Follow-up plan?
Yes, so we'll do the refill for you, and because of your acid reflux, we can see you again in 4 weeks' time and see how you're doing.
Sure, doctor. Yeah,
If it still continues, then there are other tests that we can offer.
sure, doctor. Sure.
Okay,
Thank
thank
you.
you.
Yeah. Okay, what do you think?
This really threw me off guard.
It's tricky. It's tricky. That's why I bring it. It's tricky.
Yeah.
So if every white dot in the throat is tonsillitis, she doesn't have fever. She didn't tell you that she have throat pain and you didn't ask. She doesn't have coryzal symptoms. Yeah,
Hmm. Didn't she
cough.
say she has
Yeah.
throat pain?
No, she told you
And then I,
I have white spot, doctor. This white spot is always coming to me.
yeah, so it's now in the end I felt like, oh my God, this is HIV. I don't know
No,
what
well,
it is.
again, we don't know, but it's not
Yeah,
HIV.
we don't.
I will tell you what it is, okay?
Mm,
Because that's a very simple diagnosis and very common, and it's important, okay? Unfortunately, you can see that, which is what is happening in real life, okay? That, oh yes, patient want antibiotic. Let's give antibiotic, okay?
mm,
And then antibiotic for throat, antibiotic for UTI, and then the patient at the end will have cancer, for example, or even simpler thing that doesn't need antibiotic, which this case. So this case, that's called, tonsillar stone. I don't know. Do you know what's tonsillar stone?
mm,
Stones from the tonsils?
mm.
No?
Yeah,
That's that's very simple, which is common. Okay, patient with bad hygiene, okay, mouth hygiene, and you can see that she have a decay here and she ignore. Okay, she's having, oral sex, which we said that's usually not the normal, you know, site of having, sex. So also that's probably need to be addressed. Okay, it's up to her for sure. With that, you cannot interfere in her preference. But again, we have, God create vagina and create for that purpose. So, that's why there is vagina. So, probably other forms of sex is not ideal. So that's also maybe need to be addressed. Okay, and then she have reflux, and now you can see her mouth, how her tongue is white. Usually you will find that in people who's smoking cigarette, you will find this white will be covered with little bit of tar, and then with the people with reflux you will find this white as well, because the acid is making inflammation, and probably the acid is making also inflammation in the tonsil, chemical inflammation of the tonsil, and that will predispose to forming the stone, tonsillar stone. Okay, tonsillar stone is basically debris of the food are
Mm.
are becoming built up in the crypts. Okay, because the tonsil is not smooth. The tonsil have crypts, okay, have like, deep holes in it, okay, and these deep holes can, some people will have very very deep and wide holes, and these deep and wide holes can accommodate food, okay, and then with food accommodation and the reflux, and then bacterial growth, especially, if there is no good mouth hygiene, that will build up and make these stones, okay, will be built up of things and will make very hard stones and will make a very bad smell, okay, and might also make lumps. She will feel lumps there,
Mm.
and actually some people are expressing it with cotton bud, press on the tonsil, it will come out, okay, and they are sometimes they are very recurrent and very bad and very large, okay, and making problems for the patient. So, and if you ask her if she's mouth breather or not, because that's important, that's why she have a hay fever. She will tell you, yeah, I'm mouth breathing, and that will add, to the formation of the tonsillar
Okay.
stones, as well as reflux. So I need this connection to be, in your mind, because it's common. Reflux can increase the symptoms of the hay fever. Probably this patient doesn't have hay fever. She's treating the hay fever and there is no improvement with the fixofenadine and the nasal spray, because we are not addressing the reflux. So the reflux itself can cause tonsillitis, chemical tonsillitis, can cause tonsillar stones, can cause chemical rhinitis, can cause otitis media and ostichian tube dysfunction, which I
Mm.
think we discussed it once in the in the YouTube channel long time ago. I think the first video that I did, which I said the extra GI manifestation of reflux disease, and one of them, these are also chronic cough. Chronic cough can be the cause of reflux disease. So that need to be addressed. Okay, so we are just prescribing the antibiotic for her, and they keep
Mm.
saying, "Oh, pain fever score, pain fever score." Maybe the last time she was feverish, maybe yes, maybe not,
Mm.
because no one examined her. So it's worth
Mm.
bringing her in, examine her, and see. Because tell her, well, I'm not sure that from your, photo, and from your history, that you might not have infection. That might be something called tonsillar stone. And you need to ask, is it always in the same side? Because you need to exclude sinister causes, which you touch base little bit on it, which you say, do you have hoarseness of voice? That's important, okay? Does always the tonsillar stone or the swelling is happening in one side of the tonsils? Okay, is it always, having this white spot or the white spot coming and going? Okay, so leukoplakia, erythroleukoplakia, these are all are signs of probable cancer. So you need to make sure, is there is any pain in the tonsil, any pain in the ear? So unexplained persistent pain in the throat and especially unilateral and the ear more than 3 weeks, that's an indication of referral to ENT. Okay, so you need to exclude two red flags here. Red flags of cancer,
Okay.
the normal white sweat, night sweat, and weight loss and anorexia, loss of appetite, generalized fatigue, lumps and bump, and then the throat specific cancers, persistent hoarseness of voice, persistent, ulcers in the mouth, persistent pain in the throat or ear with unexplained, and then red flags of infection. Okay, so does she have high grade fever? Does she have, the uvula is pushed towards one side of the mouth? Okay, for quinsy. Okay, does she have any odynophagia? Okay, or not? I mean, difficulty in swallowing, pain in the swallowing. That's also one of the things that need to be asked. Okay,
Mm.
so these are the data gathering of concern, and then she throw you with another layer of complexity. So maybe
Mm.
I shouldn't make it that complex. Okay, but now it's very common, I think, because in the daily news, or or the mirrors, okay, UK mirrors, I think they make an article regarding oral cancer, and the relation between the oral cancer and the oral sex. Okay, so half of the patients coming to me worried. Okay, either males, either females. Okay, so well, yes, oral cancer have a relation with oral intercourse. Okay, for if the patient have human papillomavirus. So for example, patient having human papillomavirus is not treated. Okay, and they have, so the virus can come to the throat and can cause some sort of cancer. The other thing, chlamydia, gonorrhea can come to the mouth, okay, and
Mm.
and also can be present there, asymptomatic, and or it can cause complication in the future. Throat swab is not common to be done in the GP land, to be honest. Okay, so I will be eager to send her to the eye cache. Okay, I didn't see it in my clinic being done. To be honest, I didn't do it while I am in the IGP. I did it when I was in the eye cache. Okay, and during my training. Uh, I didn't do it in. It's not big deal, but the issue is, oral sex have different follow up than the other the other sex. Okay, so it's always better to let the eye cache deal with that. Okay,
Okay.
coming to the treatment of, so that treatment, so that patient, you'll tell me, okay, I do appreciate that you would like it, an antibiotic, but from your history, I don't think what you have is tonsillitis or infectious tonsillitis. Okay, and actually your fever pain score is not high, is not indicated for antibiotics for the time being. I would rather, because to be more cautious, because the 3 times that we prescribe for you the antibiotic, no one examine you. What your thoughts about coming to my clinic to examine you, because there is a couple of things running in the back of my head. Okay, it can be cause of reflux. Okay, can be the STIs. Okay, can be something called tonsillar stone, or also very rarely, which I think it's not in your case, can be sort of serious growth. Okay, but from what I get from you, that you don't have any ulcers, you don't have any pain, you don't have this, so I don't think is that serious. But I would like to be more thorough and would like you to come in. If it seemed to be tonsillar abscess or tonsillar stone, there is multiple things that we can do. Okay, first of all, let's treat your reflux. Okay, I will give you PPI and then address the this this lifestyle. Okay, ask about her weight. She's drinking alcohol. Decrease the alcohol. She's smoking. Probably she will benefit from decrease the smoking. We need to keep your nose always open so you will stop the mouth breathing. Okay, and that will help little bit with your symptoms, and then maybe after 4 weeks of the gastric acid suppression tablet, we might review that and see how is your symptoms, and then the small meals, last meal to be 4 hours before sleeping. What about alcohol? What about coffee? What about tea? What about water? Increase the water intake. And the other thing, things specific for the tonsils, the tonsillar stone. I meant to tell you that what mean of tonsillar stone. Have you heard about that term? No. Well, tonsils just build up of debris of food and bacteria in the crypts, or in the holes of the tonsils, and that will make this white spot that is coming out as stones, okay, or hard substance and very bad smell. Uh, I would strongly advise you to try over-the-counter mouthwash. Okay, uh, maybe you need to refrain from, for the time being from having oral sex. Okay, always, brush your teeth properly. Okay, at least 3 times per day, and then a lot of water intake. That should help with your symptoms. Coming back to referring you to the, you know, to the operation. Okay, for the time being, I don't think that there is any need, no necessity of the operation. Okay, because the tonsil is an important organ in our body, as the first line defense on the oral cavity against any infection and any organs coming from organelles or viruses or harmful infection coming from the environment. So not having them, that will impair your local immunity, and then usually we don't remove them except if it's needed, and the operation carries some risk as well. um, when you come, we can discuss that further. Okay, and then, safety netting. If you have this, as you said, symptoms of quinsy, symptoms of cancer, okay, please come back to me and then we'll discuss further. Is that clear?
Yes, yes, yes. Thank you so much.
Are you sure? Are you
Yeah, yeah.
convinced?
When I actually saw the picture, I was like, oh God, this doesn't look like tonsillitis, but I'll just wing it with
Yeah, yeah, that's
tonsillitis.
true. That's true because tonsillitis, okay, usually would not. Yeah, it can be single points, but you
Yeah,
also
but it
tell the
seems a bit
patient,
bigger
can you?
than it's a bit
Yeah,
bigger. Yeah.
yeah, and can the patient, feel her, lymph nodes, okay, to anterior cervical lymph node, and very uncommon to be only one tonsils that inflamed,
Mm.
so and you can see here there is no inflammation, no hyperemia. Okay, it seems to be normal throats. Okay, yeah, there is little bit of paleness here and there, probably that from the oral hygiene, and you can see there is, oh, and there is
It
decay there.
carries as well.
Yeah,
Yeah.
so yeah, so
So,
it seems to be, bad oral hygiene. Yeah?
so bad oral hygiene, the reflux making the tonsillar
Bad
abscess,
oral hygiene,
tonsillar stone worse.
yes. So, reflux, oral hygiene, and mouth breathing. I will go through the risk factor. Okay.
Okay.
So data gathering, we say about throat, okay, is it intermittent or continuous? And then yes, fever, dysphagia or dinophagia. And then what about the nasal the congestion, and then the oral ulcer, and then um, if patients come in with recurrent mouth problem, ask about, make it as a routine, please. Okay, about oral sex and STI and immunosuppression, running in the family or not. Okay, that's important. Okay, halitosis is one of the questions that we need to ask, and globus, that's coming always with the reflux. Okay, and anxiety, or if sometimes coming with more serious things. So it's always important to ask about globus. And then caffeine and alcohol and smoking is one of the important things. Peritonsillar abscess. So you need to, yeah, yeah, it can be, the quinsy will be unilateral, pushing toward the uvula towards one side of the mouth. Okay, and the other thing, the trismus also is one of the important things, with inability to open the mouth. Okay, that's what an indication that maybe there is deeper inflammation and infection in the neck. Please don't underestimate that, because with quinsy and peritonsillar abscess, okay, these are emergencies. Okay, so some emergencies will be able to drain the peritonsillar abscess or the quinsy, and some emergency department will not be able, and they will need the ENT registrar or even consultant. Even if I don't advise you to do that. Okay, because the quinsy draining, we are entering through the needle, and it's very critical area. Okay, because if you just pierce the tonsil, behind the tonsil from the outer side is the carotids. So if you don't have vascular surgeon in the hospital, again, for sure not for the GP, but maybe you are GP out of hours and you want to try, I told you, please don't try, from my experience in the emergency. Because if you don't have a careful approach, and then the needle simply will pierce the carotid or the internal jugular vein, And then if you touch one of these arteries and with the inflammation, either you will introduce the inflammation in them, and that's sepsis, or you might rupture one of these arteries. Okay, so be careful. Okay, but especially you are entering from the inner side, not from the outer side. From the outer side, when we are inserting the central CVC, the central catheter or something, first we used to do it blindly, but nowadays we are doing it ultrasound guided. Second thing, when we are here, is easy to compress. So if the hole here, it's easy to compress, but if you are entering from the opposite side and inflamed, is not easy to compress. So that can lead to serious complications. So even if you are in the out of hours as a GP, please don't try to drain any abscess. Okay. Um, and then the tonsillar, predisposing factor of tonsillar stones, deep crypts, okay, something in the anatomy, chronic infection or inflammation, okay, and inflammation doesn't need to be infectious, can be chronic chemical inflammation, okay, poor oral hygiene and posterior nasal drip, smoking, and then chronic mouth breather, which half of them are there in that patient, okay. The red flags of of any throat infection. Okay, so stridor, which mean narrowing of the airway from the larynx above. Okay, will give us stridor. Okay, and then inability to swallowing. Okay, drooling of saliva. Okay, that's also an important red flag. And then the trismus, and then for sure, if the patient have fever, and then the quinsy symptoms. Okay, or rapid swelling of the neck, because the tone the abscess in the deep layer of the neck can just move around the and deep in the layers of the neck. Okay, I had a patient that he is 21 years old. Okay, presented with tonsil, um, tonsillar pain. Okay, oh, this viral infection, don't worry, and this and that. Don't They didn't give him antibiotic, and then he came to me after 7 days. He's saying, doctor, I'm never cured. That yes, my tonsils become, there is no inflammation in the tonsils, okay, but I'm still getting fever. And then I'm examining the patient, yeah, the tonsil, okay, there is nothing in the tonsil. And then putting here my hands, there is nothing here in the lymph node outside. And then I'm seeing there is a lump down there, here in the mid of the neck, maybe a little bit above the apex of the lung. And then I'm telling you this is painful, it's only a little bit. And then I'm taking temperature 39, okay. And then I said, that seems to be abscess. And then I called the ENT. The ENT was joking in the phone. He didn't believe me. Let me see. I used to be an emergency doctor. I know what I'm telling you. I think that there is a deep abscess in the neck. So he told me that's impossible if the tonsils are clear. So, well, that's what is happening now. Okay, so I would like you please to see the patient. I will send him to you. Okay, and I need you to see the patient. He told me, okay, let the emergency department say at him. No, that will be wastage of time. Okay, that patient need an ultrasound scan now. And that happened. So yeah, when he saw, he understand what I'm saying. Okay, it's rare, very rare to have abscess deep in the neck and then the tonsil will be completely cured. They make it ultrasound, they find very deep abscess in the neck, and then they did ultrasound guided aspiration of the abscess. Whatever you give this patient or antibiotic, usually the antibiotic will not be effective in draining the abscess for sure. When there is abscess, when there is definite source of sepsis, you need to drain the definite source of the sepsis. Okay, when you have, for example, when you have patient having pyelonephritis and obstructive pyelonephritis, okay, so have infection in the kidney and infection in the urinary tract, and there is obstruction, that's an emergency. Why do you think what they will do? Well, they will not for sure try to remove the stones now. They will, because the kidney now it will become bag of pus. So what we do, ultrasound guided nephrostomy, okay, drain the pus, let the antibiotic also cover the blood and remove the sepsis little bit from the blood, and then after that they will go and try to remove the obstruction. The same concept, okay. You need first to drain the abscess, cover with the antibiotic, and then treat the original pathology. Okay. Otherwise, the patient can be critically ill and and can die from sepsis. Okay. Um, yeah, sorry, I went outside a little bit about the the concept, the context of the case, but it's just is the same concept in medicine. It's the same concept, and good to have that build up of experience in your brain, so you will be able to negotiate the secondary care. Okay, you don't need to take the secondary care opinion as granted. Okay, you are a doctor, you will finish this exam, you will become a GP consultant. Okay, then you need to to voice the your patient. You need to voice to give you need to raise up the voice of patient. If you feel there is harm, or there is some neglect, or there is some uh, better service can be offered to the patient, don't just say, it's not my business, I already refer him. No, it's your business. If you have the knowledge, it's your responsibility to voice your patient, and try to let him have the best care. Okay, the best medical care. Indication of tonsillectomy, I think all of you know them. Okay, 753. So if 7 in 1 year, 5 in 2 years, and then 3 years need to be documented. Okay, and have the antibiotic, or more than one episode of quinsy. Okay, or the the symptoms of the tonsillitis affecting the patient quality of life, or if there is suspicion of malignancy, and we'll see what is the signs of possible malignancy. Or the patient can have obstructive sleep apnea from the enlargement of the tonsils. Okay, which is very common in children to have obstructive. So obstructive sleep apnea is not only disease of adults, it's also there is children have obstructive sleep apnea secondary to the tonsil, secondary to adenoid. Okay, so that's something you need to think about. And the treatment is not CPAP in that situation. The treatment of this situation, removing the obstruction. Okay, the CPAP in adult, or some children also might have CPAP, is regarding the functional obstruction of the airway. Okay, the muscle weakness of the airway. Okay, then you need to give them the CPAP. But there is a mechanical obstruction of the airway. The treatment is removal of the mechanical obstruction, if you can. Okay, because some people will have cancer, you will not be able to remove it, so you might consider just the interim therapy of them. Okay. Uh, Antibiotic, no. Oral hygiene, and then treatment of the reflux. Okay, and then refer for ICASH for the STI. Okay, for a swab, and then give some advice regarding trying to avoid unprotected intercourse, even in the oral things. Okay, they can wear condom as well. Safety netting, as you did, regarding the infection and regarding the cancer, and then it's reasonable to see her within 4 weeks. Okay, be aware about fever pain score. Okay, which fever within 24 hours. The patient will come within 24 hours from appearance of the fever, of the symptoms. Okay, or you have exudate in the tonsils. Making sure the exudate is abscess. Okay, be aware about the diphtheria tonsillitis. I have a specific shape of tonsillitis. I didn't see it in the UK, but you know, who knows? You might face one of the patient with diphtheria tonsillitis. So take care about it. Okay, and then attended within 3 days of the symptoms. Here, fever more than 38.5 in the first 24 hour, and then attendance within 3 days. Oxidate, and then the tonsils appear to be inflamed, and then no cough, no coryza. So cough and coryza usually denoting that there might be a viral infection rather than bacterial infection. And then if they score up till 1, there is no antibiotic. 2 to 3, you can give delayed prescription. 4, 5, you can give immediate antibiotic. The no fever pain score now subside the center criteria, because it's more sensitive. Okay, more sensitive in terms of streptococcal infection. Okay, in terms of streptococcal infection. What are the signs of cancers? Okay, in the throat. Okay, unilateral throat pain. Okay, without reason, and then more than 3 weeks, or there is unexplained lump to the neck. Okay, any blood in the sputum, also difficulty in swallowing and pain in the swallowing. Okay, which means dysphagia. Okay, due to the upper airway. That's also a referral. Hoarseness and persistent hoarseness of voice, and then and then the normal symptoms of cancers, like unexplained weight loss, and then fever, and all of that. Okay. And just a repetition, okay, because the symptoms, the symptoms of cancer more or less are the same, are the indication of the 2 weeks wait for ANT. Okay, that's an important to know. Keep in mind also persistent unilateral ear pain with normal ear examination is an indication. I think this is maybe the third or the fourth time I'm explaining that in the course, because that's important. Okay, that's important, especially patient coming from Asian, Far East. Okay, the nasopharyngeal carcinoma is very common there. So unexplained otology with normal ear examination is an indication to be referred to the ENT. Okay, persistent oral ulcer or even tonsillar ulcers. Okay, that's also an indication of 2 weeks wait. Okay, so that's all what I want to say in this case. I hope you learned something from this case. I'm I'm happy for any question if you have.